or info@milkmatters.co.za, Durban 031 266 0567. Consult the Expectant Mother's Guide for breastfeeding consultants, private baby clinics, and childbirth educators. Phone the Childbirth Educators Hotline 072 351 0051 to find the childbirth educators in your area, as most of them also run well baby clinics. Lactancia League, www.lactancialeague.org, breastfeeding support groups. In public without anyone noticing. As a result of the adjustment of the mother's body after birth, as well as the lack of sleep, she may lose interest in sex. Remember that there are alternatives to having intercourse and showing your love for her, like a kiss, a hug, or holding hands. Due to the changes in hormones, the vagina may not be lubricated enough for intercourse. There are some products available to help the mother with the situation. Breastfeeding provides a protection against falling pregnant again too soon. If your baby is under 6 months old, your periods have not yet returned, and all your baby's sucking needs are met at the breast, day and night, you are unlikely to conceive another baby during this time. Certain forms of contraception taken during breastfeeding could be contraindicated. The recommended forms of contraception could include the mini pill or the breastfeeding pill, condoms, or the intrauterine device, although this does have its risks. As a couple, you should discuss the contraceptive options available with your doctor or health caregiver and decide what method would be suitable for both of you. Other ways in which you can be supportive to your partner include the following. Be available for answering telephone calls when mom is breastfeeding. Bring baby to her at night when baby wakes for a feed. Show your support by verbally encouraging her, especially when other people ask questions. Prepare her a snack or a drink while she's feeding baby. Play with your baby. And most importantly, give your partner a hug every day. Breast milk saves lives. Did you know that 30 ml of breast milk a day could save a baby's life? South African Breast Milk Reserve is one of the charitable organizations that bring donor breast milk to babies born in distress and that find themselves in the care of neonatal intensive care units. Babies born prematurely are at high risk of contracting an infection known as necrotizing enterocolitis, NEC. NEC is an acute inflammatory disease occurring in the intestine of premature infants, causing extensive necrosis and ulceration of the bowel. NEC often leads to death. NEC appears to be associated with the initiation of artificial feeding. Human milk, whether mother's own or a donor, has been shown to provide protection against many of the known risk factors of this disease. The Breast Milk Reserve provides breast milk to premature babies in the care of both public and private health facilities. So your donated breast milk can save the lives of babies that are not yours. There are breast milk banks in the major centres of South Africa. If you would like to become a donor, please contact South African Breast Milk Reserve at 082 700 0409 or www.sabr.org.za. Cape Town, Milk Matters on 021 659 5599 or info@milkmatters.co.za. Durban 031 266 0567. Consult the Expectant Mother's Guide for breastfeeding consultants, private baby clinics and childbirth educators. Phone the Childbirth Educators Hotline 072 351 0051 to find the childbirth educators in your area, as most of them also run well baby clinics. Leleche League, www.lelecheleague.org, breastfeeding support groups.